So we're here to talk electronic information systems. I know, please don't go away. This is something that's important for all of us. Our work changes patient care, and it changes service design too. So recording what we do day to day is important if we want to get the resources needed to achieve the best possible standards for our patients. As professionals, we also have a duty to keep accurate records. It's part of our job. And of course, the government strategy is for the NHS to be paperless by 2020. If we do this properly, it provides the evidence needed to make the changes we want to see happen in our services. It's an opportunity for each one of us to make a difference. To achieve this, of course, information needs to be complete, accurate, and input in a timely fashion. The right information also means services can be planned appropriately, including strategies to direct people away from A&E. It's about capacity and demand. It also helps demonstrate that our care is safe, effective, caring, responsive and well led. We can show this by monitoring outcomes. Things like length of stay and how long it takes to see patients, all of which helps show we're achieving a good standard of care. In other words, they're indicators of our performance. So recording our work accurately is really important. Whether it's the electronic staff record system for sickness and annual leave, which of course links to payroll so we all get paid correctly each month, or the safeguard system for clinical incident reporting, or CASE for recording community activity information, and of course PARIS for patient records. Ultimately, it's all vital for good patient care. And if the correct information is entered, we get reports from Tableau that we can rely on, helping us use information from the different systems to look at all types of performance, including patient activity, finance and HR. So imagine the electronic record is a snapshot of our day. If we miss recording activities against appointments, not only is it like erasing lines in our paper record, it looks like we've only done a fraction of our work. It's like a fruit picking job and getting paid per basket of strawberries. The electronic records are our baskets of fruit. So if we pick strawberries but only put some in our basket, it looks like we've achieved far less. And when it comes to payments, we get money for fruit in the basket, not what we've dropped or eaten. It's the information we store on the system, the strawberries in the basket, that earns the income and allows us to plan and deliver services, not the information in our heads or on paper. And if you think, it's the baskets of strawberries that add up to help the farmer calculate yield and annual income, which allows her to plan activity for the entire farm. It's her version of Tableau. It's the same for service design and planning. Our basket of strawberries might not seem that important if we drop a few or eat too many, but if we all do this, the information on which we plan everything starts to be wildly out. The very health of our patients all depends on our individual baskets of strawberries being properly counted. Like when Oldham CCNT saw a 30% rise in activity from the Royal Oldham Hospital, with paediatric beds at capacity and referrals increasing from 17 patients per day to 28. Correct reporting helped us secure 4 extra paediatric nurses, which ensured enough staff to provide safe care. And of course, not recording the correct information has serious consequences. If a patient appointment doesn't have an outcome recorded, then it's not possible to know if the appointment went ahead, or if clinical interventions happened but weren't recorded. This means clinicians can't see what's being done when using a full electronic patient record. It's really important for both clinical governance and performance. It means the information we make decisions on, clinically and strategically, is totally wrong otherwise. Ultimately, this kind of failure to record correct information could lead to the loss of our reputation and our ambition to be a valued partner. So we've all learned what hasn't worked. Now we're continuing our journey and need each member of staff to help develop and improve our systems. We all want to deliver excellence for our patients, so let's pull together and make this work. There's help and training on hand to support all of us, whatever our role. So carry on picking strawberries as brilliantly as we've always done, just don't forget to put them in the basket.